Good morning. My name is Ayanbajo Ibidapo. Once again, I welcome my viewers, my audience to Online Tutors Hangout. This morning, we're here not to talk about teachers, not about students, but to talk about everybody. And the issue at hand is the scare in town. The scare in town is coronavirus, COVID-19. And against the public opinion that it's not in Nigeria, but let me please permit me to inform the public that has been reported of 5 new cases in Nigeria, which shows that there's an increase in the number of infected persons. Okay, so we don't know what is going to happen next. According to information reaching us this morning, is an area of Lagos State around Ipaja axis where we have the Chinese conglomerates, residing in that particular one of the estate called Gowon Estate. What we gathered this morning was that some of the Chinese living in that estate had gone for some tests, having some symptoms that is related to COVID-19. So if those Chinese have been tested positive as at this morning, it simply means that the number of persons having COVID-19 would have increased from 9 to about 40 in Lagos State. So what I will say, the spread it's contagious, and we need to know how to contain this virus. Okay, so but let me please remind our public that before the emergence of COVID-19 in Nigeria, the Federal Ministry of Health, through the National Health Scheme, was already battling with a virus in the system. Again, the virus that was being managed by the National Health Scheme was popularly called schistosomiasis. Now, the worry and the scare is this. Now, the emergence of COVID-19 has silenced that voice of schistosomiasis, and they have a relationship. Schistosomiasis has to do with bodily fluids and muddy or slummy areas where we have kids that play with sand, rubbish, and the level of hygiene is really very low. So, and with this outbreak and a pandemic about COVID-19, which can be spread by airborne, so we see a national health scheme dealing with two stronger enemies with less capacity, because as we speak, several countries have said they have the cure. United States came out yesterday night and said they had a cure. Israel came out a few weeks ago, they said they had a cure. North Korea and South Korea have been able to contain the virus. But here in Nigeria now, the effect is enormous, because we are the most populous black nation and we are too religious. As we speak now, the Lagos State government yesterday, through Babajide Sanwo-Olu, the governor of Lagos State, did say, and I quote, that there is now a ban on public gatherings of persons, business premises, churches, mosques, schools. So even as at this morning, a communique was sent to all Directorate of Education that all schools in Lagos State be shut down, starting from Monday. So it simply means that the preparedness of all the stakeholders, it's not as we expected. This should have been done over time, and the communication shall be carried out by the National Orientation Agency. But okay, yes, that they've come out to say this, but how far can we go with the implementation? Yes, several NGOs have come out to say these are the methods we need to use to really fight this scourge together. Because if we don't fight this scourge, well, we might be dealing with a stronger virus that wipe out the entire black nation. So COVID-19, yes, it's a virus, but it can be fought. That's the truth story. It could be fought. So the symptoms of COVID-19 are enormous, and for what we gathered so far, these experts and the medical officers have said that patients suffering from COVID-19 may not necessarily have malaria, may not necessarily have body temperature, may not necessarily cough at the initial stage. So it simply means that some might be having COVID-19 and may not have expressed the symptoms like coughing or sneezing or body temperature. So that is even putting everybody at a bar. So we don't know who has it, we don't know who's living with it, and we don't know how to contain it as we speak right now. Okay, sensitization and public enlightenment across all institutions should be carried out. In churches, it is not the time for us to gather, but it's time for us to go back to our Bibles and our Quran as Muslims. So it simply means that we need to manage how we move, and we need to manage our public gatherings. So effect, the effect as we speak simply means that our children will stop going to school for the next 4 weeks, and the effect now it's lump sum, and our business owners would be having a slight recession, because globally we're having a recession in some countries, in China, in Hong Kong, in South Africa, in Germany, in Spain, even in Italy, where we have most of businesses shut down. So it simply means that during this period, it may be 4 weeks, it may be 4 months, but please, it is advisable to our audience and fellow Nigerians to please spend wisely, okay? Wash our hands, maintain a very clean environment, and watch how we greet or we exchange communications with fellow people. And it's also advised that we don't sneeze anyhow in the public. So our NGO, Education for All organization, will also help in this process by going to the community starting from today, to reach out to those communities and sensitize that. So we are partnering with a disaster agency in Nigeria known as CDMO. So they are to mitigate disasters, after the effect. So because oftentimes when we have disaster in our environment, there's always what we call the impact effect. So the impact effect of this COVID-19 on the society is quite large, and we need to contain the virus. So the advice as by the World Health Organization and Lagos Ministry of Education is, if you are suspicious of someone who has the virus, the person should go for a test at the testing center. Number 2, the person should go for treatment. And number 3, the person origin of COVID-19 should be traced. And once again, I say, get informed, get involved. My name is Ayanbajo Ibidapo. Once again, thank you and God bless.